Today we are discussing the dreaded cough. Questions concerning cough is one of the most asked questions in my pharmacy. Why do we cough? What brings on a cough? What exactly is happening on the inside when we're coughing? When should you see a doctor about your cough? And the most common question I receive, can I give my 2-year-old this cough medication even though it says for children over the age of 6? Hello, my name is Dr. T and I've been a pharmacist for over 20 years. And today we are discussing cough. Let's get started. So there's two types of coughs. Coughs can either be dry or productive. Dry coughs are a defense mechanism in reaction to some type of blockage or foreign material in your throat. They can also be caused by asthma or certain medications. Productive coughs, also known as wet coughs, produce mucus and phlegm that comes up from your lungs, or it can drain down the back of your throat, causing nasal drip. Productive coughing is your body's way of clearing mucus from your lungs. And because it's helping to remove foreign objects as well as mucus, it's a good idea to not stop it right away with the cough suppressant. Now, on the other hand, persistent coughing can interrupt your daily activities, it can interrupt your sleep, and it may be because of an underlying condition. Upper respiratory tract infections usually cause a slight cough, but they tend to go away on their own. And this is called acute cough. Coughs that last over 8 weeks are considered to be a chronic cough and may need the attention of a medical professional. You should definitely see a doctor if your cough lasts over several weeks and is accompanied by smelly green or yellow phlegm, if you're shivering with a fever over 101 degrees, coughing up blood or tinted phlegm, wheezing, or having shortness of breath. I repeat, these are all situations in which you should seek the professional advice of a doctor. These are not situations that you will come to the pharmacy and ask your pharmacist for something over the counter. So for our little ones that are not able to take the over-the-counter medications, there have been many studies that suggest honey is actually a better option and a more healthier option. In fact, children under the age of 6 have been strongly advised not to receive these medications as they cause cardiac arrhythmias, hallucinations, and decreased consciousness. So to answer your question, can you give your 2-year-old or your 3-year-old half the dose of a cough medication that's meant for a 6-year-old? The answer from the pharmacist should be no. Well, it really depends on who you ask. So here are a few recommendations that you can try before going directly to the over-the-counter medication. Honey. Honey is full of amino acids, vitamins, flavonoids, and antioxidants which work excellent for the common cough. Honey has antibacterial, antiviral, and anti-inflammatory properties. In fact, the antimicrobial effect of honey has been proven to kill certain bacteria such as Staphylococcus and Streptococcus. And these bacteria are found in the upper respiratory tract, which makes it an excellent agent to help against the common cough. There was a study that was conducted by the Archives of Pediatric Medicine, and this study measured honey against dextromethorphan, which is the main ingredient in most of the over-the-counter cough syrup. It's what DM stands for in Robitussin DM. Parents rated honey more favorable as a relief for their child's nighttime cough and quality of sleep. Therefore, the study concluded that honey was a better option associated with sleep difficulty and upper respiratory tract infections in the young ones. Like honey, ginger has been used in many cultures for many centuries as a cough remedy. Its anti-inflammatory properties work on the inflamed airways, helping breathing. Pineapples. Yes, you heard me correctly. Pineapples can actually help with your cough. Pineapples contain an enzyme called bromelain, and this enzyme is used as a potent expectorant. And this is very helpful if you're suffering from a wet cough. A quick recipe would be a half a cup of fresh pineapples. Wait, you guys know you knew it was fresh pineapples, right? A half a cup of fresh pineapples, 1 inch of ginger, and a tablespoon of honey. You can add a little water to it and just sip on it throughout the day, and you'll see that your cough is being soothed and you're able to bring up the phlegm that's sitting in your chest. Next, you need to stay hydrated. Excuse me. I can't stress enough the importance of staying hydrated, and this is especially important for dry coughs. Warm water drinks such as herbal teas or broths are very good for your dry cough. Inhaling steam for blocked and inflamed airways has been a treatment that doctors have recommended for years. It may be a tedious process, but it works wonders in loosening up mucus in the chest area and helping you to bring up phlegm. This can easily be done with a steamer. If you don't have a steamer, you can simply boil a pot of hot water, gently put your head in it, and put a towel over your head for about 5 minutes. You can also add a little menthol or eucalyptus oil for a more potent inhalation. Saltwater gargle is our next one. Gargling with warm salt water helps to decrease the inflammation within the back of the throat. If your cough is accompanied with a sore throat, a warm saltwater gargle will work wonders. Saltwater acts as an antimicrobial agent, soothing throat irritation, reducing the phlegm at the back of the throat that causes the urge to cough. And as you're gargling, you want to hold the salt water in the back of your throat for a few seconds before spitting it out. And be sure not to swallow the salt water. It may make you throw up. Next, we have lemons. And lemons help with cough in 2 ways. First, it's loaded with vitamin C. And second, it works as an expectorant. And by having lemon water on a daily basis, you're preventing coughs and colds altogether. For immediate relief from a cough, sprinkle a little black pepper and salt on a slice of lemon. The black pepper works by stimulating and circulating the mucus, whereas the lemon acts as an expectorant, and the combination of the two, this works as a magnificent cough suppressant. Now on to herbs that can help with your cough. Thyme. Yes, I said thyme, the spice that's used in cooking. Thyme acts as a great remedy for coughs, bronchitis, and sore throat. It's rich in antioxidants that relax and soothe airways, leading to less cough. Next, there's turmeric. And turmeric has antiviral, antibacterial, and anti-inflammatory properties, which help to also soothe the pharynx, the larynx, and to act as a powerful antibiotic all on its own. Mixing the juice of 1 lemon, a teaspoon of turmeric, and a splash of black pepper into a warm drink will 90% of the time clear up your cough. So be sure to follow me on Instagram at Getting Healthy with Dr. T for quick and easy health tips like this one and this one that you can incorporate into your everyday life. Here on Getting Healthy with Dr. T, I teach you how to use food as medicine, how to modify your life to become a more healthier you. If you haven't already, be sure to subscribe and hit the notification button so you don't miss out on any of my videos. Thanks for joining me. I hope you enjoyed this short discussion on cough. And until next time, stay healthy.
Thank you for joining me. Be sure to subscribe, like, comment, and share. Follow me on Instagram at Getting Healthy with Dr. T.